My name is Seang Teak. I'm from Vietnam. I work for a biggest healthcare group in Vietnam where we have 11 hospitals and 5 clinics, and we are growing very fast. I'm the Group Chief Operating Officer looking after the operation of the entire network.
So clearly a lot of responsibility is sat with you. So what are some of the main things that you're focusing on at the moment to improve the operations of your hospital group?
In terms of hospital operation, we are looking at internal processes. We are trying to standardize processes and also centralize certain processes so that we get better bargaining power in our procurement and standardized processes so we get better consistency. Yeah. However, in terms of expansion, we are looking at 3 modes of expansion in our group. We're looking at acquisition. We either buy existing hospital and then upgrade the facility and change the brand to become part of Hoan My network system, or we build a new hospital. And thirdly is we expand on the existing location by buying the piece of land next to it and expand on the capacity.
Wow, does sound like there's quite a lot to do then. So do you have an aim, let's say in the next year, or maybe it's 3 years, of how big you'd like the group to then be? So you said you're 11 at the moment. How big would you like to be in a few years' time?
Well, our investors have given us a target that in 3 years' time we should have 20 hospitals. So I think we are right on target. We are very encouraged by the target given to us, and also the quality of care that we have brought up to the next level of quality care. In fact, our quality care has improved very much. In Vietnam, the government has introduced a quality score for private hospital, and in the past 3 years of this score being implemented, our score has gone up almost 30% every year.
And so what were some of the key initiatives or projects that you put in place in order to see that improvement?
One of the most important things is about the clinical quality, where we need to have a good clinical governance, training of doctors, and continuous medical education. It is a continuous process. And the other initiative which is very important is customer satisfaction. We survey and measure customer satisfaction, and from the customer satisfaction we use it to improve on our services.
So you've clearly had a lot of success then in the last few years in improving customer sort of satisfaction and experience, and obviously you've got great growth plans. But what are some of maybe the challenges that you're facing, say for the next 12 months in progressing?
Well, I think generally in Vietnam, the healthcare is faced with challenges just like any other countries. Staff workforce, we are in short of nurses, doctors, and also technical staff. And we have also have a program to sponsor medical students in the university by giving them a scholarship. We send our doctors for refresher course training, and we also sponsor our nurses for post-basic nursing training. So that's one of the ways to actually reduce the nursing and medical staff shortage. However, the key thing is that we need to have a good retention program. Not only training them, but retention is very important for us. We need to make sure that the staff have a sense of purpose in this organization, and they can work with a very good motivation.
It's a challenging question then. How do you give people that sense of motivation? It clearly seems people are very important in your hospital groups. How do you make them sort of feel part of the overall vision and purpose of the hospital group?
Well, one of the most important thing is the vision and the mission of the group. We have a vision to be the largest healthcare group, and we target our segment market is the middle segment market, which is the mass population. We offer good quality care at a very affordable price, and this gives the satisfaction to the staff. And the other important thing is about corporate social responsibility. We do a lot of corporate social responsibility, bringing our doctors, nurses to remote places in the highland countryside to go for giving free healthcare screening. And then any patients that we found having medical problem, if they need any intervention or procedure, we bring them back to a hospital to give them free treatment. So this gives a very big sense of satisfaction to our staff. And of course, to put them together, we need a lot of team building exercise, training after training.
So obviously there we've spoken about how important people are to your overall sort of operations and infrastructure. And earlier you spoke about processes, which obviously need to be there to support your staff and your operations. Is there a particular sort of technological or digitalisation project which your Vietnam hospitals are sort of undertaking at the moment?
Well, actually, in this HMA 2017, our hospital won 2 awards. One is on the initiative of reducing the cost of consumable in one of hospital in Da Nang, and the second is reducing downtime as well as saving costs of our biomedical downtime costs and maintenance costs in a hospital in Kulong. Basically, the idea is a simple process of DMAIC, define, measure, analyze, improve, and control. And we keep on doing this. It's a continuous process of analyzing, measuring, improvement, and controlling systematically using some software to document our work procedure. And over time, we are able to achieve big improvement in cost saving as well as downtime.
And so if you had a technology of choice at the moment, maybe something that you've already implemented or something that you would love to see your hospital group implement in the next few years, what type of technology would that perhaps be?
Well, the technology that we are in fact currently going to be implemented in the stage of developing is digital technology, where we use mobile apps, where we would like to have a continuity of off-site as well as online as well as offline of the medical care. Online being that they can use the apps to actually book for appointment, can do consultation, can order medicine, and the offline is of course our hospital where we can provide face-to-face consultation with the patient. So this is the way forward, and I see this is something that is coming, a big wave for healthcare moving forward.
And so, thinking about hospital management in Asia, what were your objectives? What were you hoping to learn, or who were you hoping to speak to at this year's event?
Well, HMA is not new to me. I've been attending HMA year after year, and HMA is a place where I always present my experience from our organization, some real data that we feel is important for us to share. But when we present, we also learn. At the same time, learning from other people's experience, best practice, and most important thing is also to get to know each other, is more getting back network again to all the old friends and colleagues which we meet once a year. It is a fabulous place for us to meet and a platform for us to discuss and to improve.
For sort of behavioural and human psychology in adapting and improving our hospitals, could you see a point at which we would, I guess, go and have conversations with people who are experts in that area to improve our hospitals?
Well, I think it is something very basic where healthcare is not just about the medical equipment, medicine, and doctor. Healthcare is a whole continuum of process where we treat the patient as a human being, treat them continuously from the day they step into, from the time they go into the hospital until they are being discharged. Some basic things like the waiting area and the courtesy of the staff, the interaction, addressing the patient by name, looking into the eyes of the patient when you talk to them. These are things that actually make a difference, you know. Not the MRI machine, whether it's 3 Tesla or 1.5 Tesla. To the patient, it doesn't make a difference. But it is the way the care is being delivered. It is what the patient perceives as quality. And this is something that very basic, which have a big impact on the patient's need. What the patient need in healthcare is sometimes very basic, not necessarily must the cutting edge technology, but it is the care, the concern, and we call it the love you give for the patient.
And so, final question. Obviously, a lot of HMA is about bringing people from different hospitals and from different countries together. And obviously, at HMA 2017, we're taking relevant parties on site tours of some of the local hospitals in the Philippines. If there was a hospital that you could visit, either in Asia or across the world, to learn how they are doing some things, is there somewhere that comes to mind?
Well, visited quite a number of hospitals in Philippines. All are very good, but one country which I would very much like to visit is Israel. I've read from books that the primary healthcare in Israel is one of the best. So if I have a chance to visit any hospital in any country, it will be Israel.
Okay, thank you very much for your time.
Thank you.